Dopamine. Yeah, what is dopamine? Dopamine is a neurotransmitter in your brain that is triggered by tyrosine. So, dopamine tends to be the chemical, I call it the feel good chemical. Basically, what happens with dopamine is it doesn't just get produced, you have to activate it. You start doing something, and then your brain says, "Oh, I like that." So it keeps producing more dopamine. One of the ways to produce dopamine is to exercise. You know how, like, you've gone to the gym and you're like, "Oh gosh, I'm feeling sluggish, I don't want to go." And then you get going and you feel really good. That is because you have activated tyrosine to produce more dopamine. The other thing that can help is increasing your protein intake, but decreasing your saturated fats. Protein is known to boost dopamine. A lot of people say that, chocolate boosts your dopamine. When you have a good piece of chocolate, it releases dopamine. A good cup of coffee, a good cup of green tea will help produce dopamine. The other ways you can produce that is meditation, walking, dancing, sexual activity, sunshine will increase your dopamine levels, your feel good chemical. Now, why do we talk about this? Because studies have shown that when you have a low levels of dopamine, you also have high incidences of depression, obesity, low motivation and energy, low focus and concentration, blood pressure issues, elevated heart rate, and even your ability to process pain. The other one that dopamine helps us with is lactation, which is crazy because dopamine tends to be depleted when you're really stressed out. And so, if you've had a baby and you're stressed out, naturally, lactation is going to become difficult for women. Now, too much dopamine has been linked to schizophrenia, and some people will even use drugs to boost their dopamine, and that's why you can see how hard it is to stop using drugs because the drugs will like push a lot of dopamine in your system. You'll feel really really good, but then you will crash from not having the dopamine in your system because it's kind of like a fake type of dopamine boosting. When we look at depression, we see a few chemicals that tend to be depleted for people to struggle with depression. Dopamine is one of them. And one of the ways low dopamine levels manifest in depression is what we call anhedonia, is your inability to experience pleasure, your inability to experience just life. All of a sudden, you used to enjoy a hobby and now it feels like emptiness. You don't have that enjoyment anymore. All of a sudden, you used to exercise and do all that, and now you're like, I couldn't care less. That's linked to low dopamine levels. So, some of the ways that we manage depression is by boosting dopamine levels to activate the system so that somebody can feel better. Amino 3 fatty acids have been known to be very good at boosting your dopamine levels. So if you're feeling a little low, you might want to supplement with amino acids and amino 3 fatty acids. And the other one is vitamin D, especially this time of the year. You want to supplement with that so that you can boost your dopamine. Incorporate a high protein diet that will also benefit you. I hope this makes sense about dopamine, and now you know what that is, your feel good chemical.